Hi, I'm Dr. Jody. I'm going to talk a little bit about how the face ages. I think this is really important. You want an injector who's concerned with the way your face has changed over time, not an injector who's going to chase the lines around on your face. You want us chasing your anatomy. So it's good to know, like, what are the typical ways that a face ages? Sometimes I get in these consults and you guys are like, I have the strangest thing. I have this line right here. And it makes me feel really bad because that's not the strangest thing. That means that we have not educated you about the process of aging in the face. And that's all you need is the education so that you can make decisions about the injections that are right for you. So when we look at this, the face ages in really predictable ways. In our 30s, a lot of these fat pads start to change. Now that can happen earlier if you go through something stressful, if you're on steroids, if you have a little weight loss. And so that all may enter into your 20s, but generally in the 30s, we start to see a big shift in the fat in our face. And as this shifts, things sort of look like they're falling this way. So sometimes we get what we call a malar jugal groove. We might see some really deep orbital rim right there. We might see a little bit of jowling early on, but all of it's related to the loss of these fat pads, and the majority of that's in the mid face. So it's why when you come in and you're worried about a line here, that we're looking to see how we can give you back volume that led to this line, as opposed to just trying to fill the line. As we get older, the bones in our face start to change. This is the one that shocks everyone. People think this is, pathologic osteoporosis, when in fact this is osteopenia, and so it's a normal process for us. Usually in our 40s and early 50s, this is what our skeleton is going through. And if you look, it's almost like the eye socket gets bigger. What's really happening though is we're resorbing some of the bone around the eye, predominantly in the zygomatic, which means our cheekbone. As you work your way down, we lose volume. You see the bone kind of shrinks up around the teeth. That's the maxilla. We lose volume in the piriform near the nose. And then the big one is all of the volume that we lose in the jaw, in the mandible down there. If you think of the bones and the fat pads like your table, and you think of the skin as the tablecloth, your table shrinks and your tablecloth grows. So when you're 50 and you come in and you do this, the problem may not be right there. It might be right here, and everything's fallen that way. So don't be surprised if you come in and some of our solutions involve treating you in an area that you didn't think you had a problem at. Oftentimes, we're able to get the most natural results when we address your anatomic changes. So our job is to bring you in, teach you about this, look at your photos with you, and determine where your face is in the sort of natural aging process and what we can do to prevent some of the consequences of aging and to support you as you go through those and to help you look as natural and as much like yourself as possible. On this wall over here, we've got a number of our before and afters, and some of these are kind of good to look at. This is a really young person who had developed quite a lot of volume loss under her eyes. She's thin, and that orbital rim has become really apparent. The treatment for this is interesting. Sometimes a little bit of mid-face volume right through here can just give you that stretch back over out the zygomatic and reduce that look of an orbital rim. What's interesting is this is not under eye filler. Most of us have really moved away from putting filler in the under eye space. The treatment we prefer is platelet-rich fibrin. So PRF in this space is your own blood spun down. We take the growth factor off the top and we re-inject it. About 3 months later, we start to see some really nice results in terms of the kind of giving you back a little bit of volume through there that's natural, it's yours. Oftentimes you guys come in and you don't like all of this, and as you've aged, you've maybe noticed that you have excess amount of fat or skin under the chin. Sometimes this is something we treat with Kybella, which is deoxycholic acid. That's the same thing that your gallbladder produces when you eat something fatty. It's able to emulsify these fat cells, which is a permanent change in the composition of that preplatysmal area. Sometimes though, it's that the chin has started to lose bone, and as we talked about the mandible right here, losing bone in that pregel sulcus, sometimes giving back some bone along that area can actually improve the look of what's happening in the under chin area there. As we kind of work your way up through here, this is a picture everyone always asks us about, what has she had done? So in this picture, you can see she's got a lot of mass here at the masseter. This is actually masseter Botox, and when we use Botox in the masseter, it's done every 3 months for a series of 3. It'll shrink the masseter muscle the first 3 months by 25%, the next 3 months by 37%, and the final 3 months, it'll be shrunk down 49%. That's in size and strength. So if your face is becoming more square through here as you're getting more stressed out and you're clenching all the time, aesthetically, we can thin that out with Botox. And that's what you see in this picture. She's also had a little bit of mid-face volume and a little bit of volume in her chin so that she's balanced. I call these the buttresses of the face. I want to see a stretch from here to here, and it really helps to balance out the skin and give her more of that kind of sleek jawline and cheekbone. We were talking about the masseter. This is a picture of someone who is pathologically clenching more so on one side or the other, and he's developed an asymmetry. And this after picture is from treatment of that masseter with some Botox. Treating that muscle with Botox is like putting the muscle in a cast. So you know when you put your arm in a cast, you take it out 3 months later and your arm's really skinny. It's how we shrink that muscle down. When it can't flex like that, it can't continue to get bigger and bigger. Some of the treatments with Botox that people sometimes confuse, they confuse a gummy smile treatment from a lip flip. The gummy smile is when you smile and you raise the upper lip so much that we can see your gums. In this picture, this is where she started. We treated her with 4 units of Botox, 2 here and here. She came back in 2 weeks later. It was better, but she still was showing gum. So we actually then increased her to 2, 2, and 2, so she got 6 more. And that's where she landed 2 weeks later. That was bringing that upper lip down. Now that's different than a Botox lip flip. You can see in this, when she smiles, her upper lip curls, so you almost can't even see it. With the Botox lip flip, we're treating right at the edge of the vermilion in the upper lip. And when it's effective, you get a splay of that upper lip, so when you smile, you can still see your lips. It's kind of important to know the difference between those, and if you can't remember what they're called, be sure you describe to your injector what results you want, because it makes a difference where we put the Botox injections. You know, what we found in the aesthetic industry is it can be kind of exclusive. People have these expectations of how they have to look or be in order to get procedures done or to fit in, and the truth is, I think the best service we can provide is to give you the education you need so you understand how the face ages, and then give you options in how we can address those changes. Everyone's going to have a different ethic around treating their face and treating aging. Some of us are going to embrace it, and some of us are going to want to stop it. And wherever you land on that spectrum, I want you to know at Fresh Faces, we respect you. We respect your opinions around this. We respect the process you want to take in addressing the issues that you're having. And you are welcome here. That's the other piece of this industry that really makes me crazy. There is no prototype. You don't have to be perfect. You don't have to be thin enough, young enough, white enough, girl enough, none of it. Everyone's welcome at Fresh Faces. You're wanted, you're welcome, and you're needed. And we want to meet you where you're at. We want to understand what's bothering you and help you find the solutions so that you can feel great about yourself.